Stakeholders in the health sector are calling on the Kenya Kwanza administration to actualize the pledged digitization of the country's healthcare system to enhance transparency. Speaking at the Kenya National High-Level County Dialogue meeting in Nairobi, the industry players said digitization of the health system will allow health facilities use the platform to enhance accuracy in resource allocation. Council of Governors chairperson Ann Waiguru said all the 47 devolved units will implement the 2020 summit resolution, which agreed to allow public health facilities to raise, retain, and utilize funds collection to manage costs.
Counties to date continue to bear the burden of cost of specialists who are undergoing training, yet they cannot replace them. Given that the Ministry of Health is responsible for the training of medical officers, the Ministry of Health and the National Treasury need to make provisions in every budgeting cycle for the payment of personnel emoluments for these doctors to allow the counties to replace them and guarantee service delivery.
We have agreed that all counties pass a law we call Facility Improvement Fund, which basically means all monies collected from the hospitals has to be ring-fenced, and it is supposed to utilize in those hospitals to improve the healthcare in those hospitals. That way, we will be having at least a reduced burden of having to wait for resources from the national government, what we normally call the normal disbursement that you know about, that we always, we are civilized governors, so we don't go to the roads with twigs and say akietu.
The health and well-being of Africans has been and will continue to be central of our prospects for economic development in Africa. That's why health futures so prominently in the EU Agenda 2063, Africa's blueprint for transforming Africa into a global powerhouse of a future.